Thanks everybody for joining us today. My name is Jeff Jenkins. I am the founder and manager of Blue Water Security Services. We are a consulting company, and today we are going to discuss with you how effective is your workplace violence prevention plan and program. So if you look at this, let's take a look at this very first slide. And I can't take credit for that phrase there. Back in the 80s, Hannibal from the A-Team, at the end of their adventures in that episode, he would say, "I love it when a plan comes together," because their plan that they had put together was successful. Sometimes it wasn't the smoothest transition from beginning to end, but at the end they were successful because of their plan. So you're going to find a theme throughout this presentation that I'm going to ask you a series of challenges. And the very first challenge right here off of this first screen is your plan regulatory? Is it written because you were required to write a plan and you needed to have something on paper because a surveyor was coming to your facility? Or is that plan actually functional, and can you track how well you're doing? So let's take a look at this next slide and have a discussion. So the agenda, what are we going to look at today? So the key elements of the workplace violence prevention program is, first, let's look at the first bullet point there, committee, then the plan. I often have seen that the person responsible for writing the plan at the organization or the facility sits down and uses a vague set of guidelines and writes a plan to the best of their ability. Then they convene a committee to discuss the plan and the elements of the plan. However, that's actually counter to the guidance found in the OSHA guide for workplace violence prevention, as well as other best practices when it comes to establishing an initial plan from the beginning. Then the second bullet point there we're going to look at is the data. And then also the follow through of the data. We all know that there's requirements to collect data, but what do you do with the data once you've collected it? And then the third bullet point is the training based off of your data and measurable results. Now, I kind of gave it away with that third bullet point, what we're going to be looking at the first two. However, it is going to be paramount that if you're going to have a successful plan and program, that you do all three steps. And then at the end, if you notice that number 2 there, it says questions. Now, obviously, this is a recorded PowerPoint, so it is impossible for you to ask me questions directly. At the end of the presentation, there'll be a slide with our contact information, and I ask if you would like to have a question answered, if you would just like to bounce some ideas off of us about your program, please feel free to contact us. We will absolutely answer your questions. You can call us, you can email us. All right, so what is an all approach to the plan? If we look at it in the way when I used to teach anti-terrorism back in my government days, and I would teach anti-terrorism to an organization within a big, huge building, I would always ask the question, who is ultimately responsible for the anti-terrorism program? And every single answer and every single time, some would blurt out security. Workplace violence prevention is no different in the thought process than healthcare. If I asked 100 hospital staff, clinical staff, or leadership, who is responsible for workplace violence prevention in your facility or your organization, and they would no doubt say the security director or security. But that's absolutely not the case. In fact, I would challenge you to look at your incidents that have happened within your facility. And I would challenge you to look at the information that you've collected and look specifically for when the security officer arrived on scene. Were they present at the time of the onset of the incident, or were they called to the scene during or after the incident had occurred? And the reason why I say that, it's a great point if you are watching this video and you are a security manager or director or security staff or safety staff, and you want to help edify that information to your leadership about how important it is for the other staff members to be involved in this process. That's a great point to be able to show them that the security staff or an officer or leadership are rarely present at the onset of the incident. So there is also a paradigm, there's also a thought process in place that says we can stop almost all workplace violence incidents. I will tell you that throughout my 35 years doing this type of work, that's actually a very dangerous thought process, because it leads to the sense of failure when you don't. So a clearer or a more measurable and a more effective actual way of looking at it is the negative outcomes. It was so important I actually highlighted and underlined those two words on the PowerPoint. If you can reduce the negative outcomes from the workplace violence incident and measure that and see how you're doing that and what is effectively doing that reduction, then that shows an effective reduction, and it also helps save your organization, which could be a significant amount of money, as well as protects your staff and the staff within the hospital. So all of this is saying at those last 4 words, there are 5 words at the end of the paragraph, is your plan measurable, repeatable, or defendable? So let's look at these questions. Why is negative outcomes underlined? So I've said that. I said that negative outcomes are underlined because it is a measurable piece of information. And when we get into the data part on the next slide, I'll really drill down into how effective it is. And then the second question there, why do I say measurable, repeatable, and defendable? Measurable. I'm sure you're getting the gist so far of this presentation, that measurable clearly means that you need to be able to see the effect of what's going on within your facility. So you need to be able to take the data that you're going to collect, but again, like I said, we will talk on the next present part of the presentation. You need to be able to take that data, look at your plan and look at what you're doing and look at your training and your mitigations and say, for each incident or for a group of incident types, are they actually making a difference? And if they're not, then let's not do them and let's find a different one to put in its place. It's almost maddening, because if you're doing something that's not making any effect on the negative outcome, it's actually, I guess, it was attributed to Einstein, but I don't think he actually said this, but it's attributed to the definition of insanity. You're doing the same thing over and over again, expecting a different result. So if you're doing the same mitigation and over and over and over again, and you're not getting a result and you're tracking it, then change that mitigation. And then when we look at the second piece, which is the repeatable. So if you have multiple facilities, or even if you're one facility and have multiple departments, those methodologies that you outline in your plan should be repeatable within the department. It should have no real variances. However, there may be a variance because we all know, like, the emergency department has way more incidents than maybe, say, a NICU or a elective surgery division or something along that lines. And then if you look at the last part, defendable. Unfortunately, we live in a society that is litigious. It's the highest it's ever been. And because of that, your plan should be able to go before a court and show that you identified your vulnerabilities, you identified your probabilities, you put mitigations in place, and you did the best and due diligence that you could do to reduce the negative outcomes of workplace violence incidents. And therefore, it helps offset the mitigation. It will not stop the mitigation. Someone's going to sue, they're going to sue, but it will help offset the effects of that mitigation. So if you look at factor one there, all of these points I've brought up lead to this one factor, not just a committee, but an informed committee. What I mean by that is if you're a committee member, or if you're the leader of the committee, or either the chairman or the chairperson of the committee, I challenge you, here's another challenge, to get the information to your committee members prior to the meetings, a read ahead per se. And the reason why that is when you conduct your meetings, if they are getting information at that meeting, you either have to convene another meeting at a later date to get the response to that information, or you have to do it on the fly while in the meeting. And both of those can be extremely counterproductive. So if you provide the information prior to them coming to the meeting, that gives the attendee time to formulate questions, information, even suggestions, and they can bring that to you to help formulate what eventually will be your plan. And then as the second bullet point says, it's a phased approach. Workplace violence is so prevalent within healthcare that you can't take it on and eat the whole pie at one time. It absolutely has to be a step-by-step process. And again, this is where the informed committee prior to having the meeting is important, because you can provide them how you see or how the phases should be laid out as you walk through the committee meetings and the different processes you need to commit to complete prior to the finalization of your written plan. So then the second slide begs the question, what is your data doing for you? And those three questions there, one obviously says, is there regulatory requirements for you to collect and report data? We know that's a resounding yes. Okay, so the second question though is a little more pointed. Is there guidance to exactly what the data is, how it should be collated, and what you do with the data? What exactly is the data? There isn't. There is very, very little guidance, and what may be out there is extremely vague. So then the third question is, what are the key pieces of the data to see the program effectiveness? Now, if you notice, I haven't said anything about the collection of the data and what you need to collect and so on and so forth. I'm not going to really dive down into that because it's an extremely detailed presentation on how and what you need to look at. But I will say that last question, there are key pieces though within your data collection that are very effective. And so if you look at the data, where I say in that second factor there, data is useless without a way to measure the mitigations against the information. So if you're collecting this data in, but you haven't looked at it and placed your mitigations up against it and say, okay, well, we've had 10 kicks this month and those resulted in this injury, this injury, this injury, this injury, and then this payout and this medical and this person left the organization. You haven't looked at these key data points. You won't be able to say, well, we put that mitigation against it, so we should see a reduction at if the next incident occurs. So that's a key element is being able to measure that mitigation against the mitigation that you placed against the incident. But as the second point there says, is it possible to have less incidents and higher impact? Yes, it absolutely can be. Could be the incident occurred and also damaged a piece of expensive medical equipment, or it could have had a major medical effect on the individual or individuals. So the numbers could be askew when it comes to a number of events and versus cost of event. However, I will caution you, it doesn't necessarily mean that there was less events as well. It could mean that just the events went unreported as an incident, but the financial impact did get reported. So I would caution you on looking at those. The key elements to look at is the cost of an event, the severity of the injury, the type of injury, and if there was any litigation. Those are like the top four to look at because those are your keys that you can really point to, and you see those starting to reduce. You can actually point to those because they're tangible. They're tangible. They're not based on someone's reporting, but it's based on the numbers that are actually found within the data within your facility. So if you look at the next slide, it's just intuitively goes to the next piece, which is the database training and mitigations. So as I've said probably 100 times now, data, data, data. Once you collect the data and you've looked at your mitigations and so on and so forth, you need to say, well, I've looked at my data and I'm going to ask myself these questions. Are we training for results? Are our training courses that we're providing, is it because we're training for a result and we're just doing the status quo? And I will caution you that utilizing, for instance, a de-escalation or disengagement training that is industry-based for all industry is problematic for healthcare because it's not based on healthcare environment and healthcare methodologies that could be found that are found out there, that it could at times be very not applicable to the healthcare environment. So if you're looking for training for that type of de-escalation and disengagement training, then try to find something that's based on healthcare or off of healthcare best practices. And then if you look at the second question, is your workplace violence prevention training topics based on best practices for healthcare environment? So we talked about de-escalation and disengagement, but other topics, for instance, I hate to lump it in here, but I'm going to just for ease of topic, is active shooter. Active shooter, the one size definitely does not fit all when it comes to healthcare, because the average healthcare worker, especially your clinical staff, are in the mindset of protecting and saving. So during a incident, what do they do? And I'm again, this is a topic I don't want to get too far into, but these again are we should be looking at topics that are healthcare specific or designed with a healthcare background. So if we look at the factor database training and mitigations, as an emergency preparedness program, if you looked at the emergency preparedness program, they use their vulnerability assessment that has a vulnerability analysis. And they use that to identify their vulnerabilities within the facility. And then they base their trainings for that year off of those vulnerabilities to help identify the gaps and then fill those gaps. No different from the workplace violence program. It should be done the same way. You should be able to identify your vulnerabilities and your probabilities. There's two different pieces there, and we can discuss that later. But the probabilities and the vulnerabilities, and then utilize that information to help establish how you need to close those gaps. And then again, as the second part, a gap analysis of your program, applying those mitigations is extremely important to the training and the mitigation part, because ultimately it comes down to budget. You don't want to be utilizing dollars. You don't want to be dedicating your dollars to a training or a mitigation that's not effective. You want it to be, as the saying goes, you want the biggest bang for your buck. So a complete program is an informed workplace violence committee and with a defined leadership. So again, as we were talking about earlier, having that information is key, and then having that clear delineated leadership. The workplace violence probability tables are important, and you can find a guide on that through different organizations. They can tell you what you should be looking for probability within your, it's about 10 factors. But then the second piece is the workplace violence vulnerability assessment. I have yet to find an actual regulatory or accreditation organization that talks about workplace violence vulnerability assessments. They vaguely may mention a tool that's out there available, and I think it's through Kaiser Permanente, but the tool is fairly okay, but it needs it doesn't really identify the actual incidents. It looks more at situational type of topics. So a vulnerability assessment of your facility should be completed. Now, I will, if you have not written or have not read the OSHA guide, the OSHA guide clearly states in there that it is absolutely not only permissible, but it is suggested that you reach out to an outside organization, law enforcement or private consulting, to come in and help you with these matters because they are the subject matter experts. One caution about asking your local law enforcement, many times they have a very linear focused law enforcement view and don't quite understand the healthcare environment. So it's not totally prohibitive, but it can be at times problematic. So I would caution that if you have them come in and do your assessment or help you assist you do your assessment, that you take a leadership role on what you want them to look at and then have them give you their expertise opinion. And then, of course, I've talked to the data collection and reporting and what you're doing with your data quite a lot. And then basing your training and your security measures and your mitigations off of that data also. So in conclusion, some things to think about. How do you know your workplace violence program is making a difference right now? If I sat down with you across the table and said, can you show me your workplace violence prevention plan, and can you show me, since you've implemented it, how you have measured the effectiveness of that plan? Second question is, can you mitigate the vulnerabilities and protect your employees and show your results from what you just told me? And then that leads to, if you were called in front of a court, if you were called in front of a judge, are you prepared for the litigation piece? Are you able to sit down and say, we did our due diligence and this is why and how, and these are the pieces that we are accountable for, and we can show our work, as they used to say in your high school math class, show your work. Same thing. Are you able to show that you looked at your information and you actually put something in place to mitigate it? And then that last bullet point, are you able or willing to ask for outside help? Too often we feel that our tasks are given to us, and that, especially in the security world, like I said earlier, I've been doing this for 35 years. And I can tell you, it took a long time for me to say, hey, Jeff, you're not the end all be all. You actually can ask for somebody else that may have a lot more experience in this topic area to come in and help. So if you are, reach out for help, because the bottom line, the goal, the finish line is the safeguarding of your staff within your facility and reducing those negative outcomes from the workplace violence incidents. And as Benjamin Franklin said in that quote, if you fail to plan, you're planning to fail. And again, this would be the time I would ask for questions. I left this slide in there. Normally I wouldn't do this in a video presentation, but I left this in there to ask you, please reach out to us if you have questions, because ultimately our goal is to help you achieve your goal. We started this business to protect others, and we have been in this career field, myself and my strategic partners have been in this business for over combined almost 110 years. And we've done this because we want to do this to protect and safeguard people is the ultimate goal. We want our clinical staff and our support staff to be able to work their daily lives and go home and have productive environments at home and in work without having to worry about workplace violence and those negative outcomes. And this is our contact information. If you would like to contact us, you can do it via email. You can call me on the office phone or cell phone, or if you still use the mail system, that's our mailing address. I would point you towards our website. It is www.bwgsecurity.com. On there, you will find our workplace violence prevention plan template, which is a guide that was based off of NFPA, Joint Commission, OSHA, and CMS guidance for workplace violence prevention documentation and for plan writing. So we took all of those different guides and different regulatory documents and made sure our guided template met all of those pieces. So it's there available for purchase, along with we will have soon, if you purchase that the guide, you will also have access to our workplace violence prevention and workplace violence incident reporting forms, which will be individually set up for both employees and contractors, and then a separate form for all others like visitors, patients, and so forth. And then also on the website, you will find that we are hosting 2 workplace violence workshops, one in September and one in October. So please take a look at our website and let us know what you think. And if you would like to join us in the wonderful state of Florida and sunny Orlando, we would love to have you attend our workplace violence prevention workshop, where you will receive the information from myself and from Dr. Kelly Austin of KLA Risk. And we will guarantee you that at the end of the 2-day session, you will be able to walk away, go back to your organization, and implement a workplace violence prevention program that is not just regulatory effective, but is effective, measurable, and with positive results in the negative outcomes reduction. Thank you.